So how we serve students, our mission is to provide access to quality and effective health care. We do that by being a primary health care facility. We have many services. We do preventative, acute, and chronic care to students. We have a dietitian, health and wellness promotion, medical lab, radiology, and immunization management, which is all students' favorite thing when we're harassing them about immunizations. We provide precepting to nurse practitioners and pharmacy students. We support and participate in academic affairs research projects. We have 2 of them we're looking at right now, and have worked with them on going forward with their grants. And then we have the Healthy Herd Champions, so that's the peer-to-peer educators that you see out and about that are doing the peer education. The current state of student health, we do not receive appropriated funding or funding from any other sources, other than the student mandatory fee. So over 50% of our revenue is generated from the student health fee. It's not adjusted annually with inflation. We received an increase in 2010 that was projected to last for 5 years, and we had that, we made it for 6 years, but we did have a 54-cent increase last year for FY17. We do charge for some sales and service, so immunizations, injections, treatments, anything other than the office visit that would be needed to do, and then prescriptions or medications. Continuing with current state, so some of our expenses are accreditation costs, administration, overhead beyond SHS, so we put money into those funds. Building maintenance, capital improvements, custodial services and supplies, I won't go through all of that. The immunization compliance does kind of end up being a big thing for us to manage with staff time and some of the requirements. Medical supplies, pharmaceutical supplies can be very costly. Repair and replacement, staff salary and benefits, that's the highest cost to our budget. And then technology, the keeping up with the computers, EHR updates and that kind of thing. Some cost reduction efforts that we've done to date. We did an external review of business office operations and decreased 0.75 FTE. We're just starting this year to try and utilize work study students. We've collaborated with purchasing and worked hard on contracts, and we're able to decrease our cost and supplies by 6.8%. And then we continue to work with our electronic health records. So the more we can streamline our processes and the more efficient we are, then hopefully that assists with our staffing. Streamlining that immunization process, we've been really trying to move to paperless, so that not only helps students, helps student health service, but also working with admissions, so it's not quite as labor intensive for them. Cross-training staff, so we have nurses doing phlebotomy, so they can go to the patient room and do lab draws if we're short-staffed or if we don't have enough staff to get the students through as quick as we want, so that helps. The rad tech does phlebotomy and assists with a lot of other tasks, and then the LPN does x-rays. We reduce our staffing in the summertime, so we really go with a very lean model. We have 1 provider and 1 nurse, so we really go with either per diem staff or 9-month staff to manage that based on enrollment and student demand. And then we utilize per diem, we call it per diem in healthcare. I don't know that other people are as familiar with that term, but so they're non-benefited, and we have them come in as needed. Some of our statistics for our current state is our total visits are increasing, so from 2013-14 in blue to 2015-16 in the green. We've had some record days of pharmacy filling prescriptions. I think they hit the top number that they ever had this fall, as well as in the laboratory. We're student-focused, really have a student-focused model, patient-centered model versus a production model. So when our students are coming into the clinic, we're not saying, okay, your 15 minutes is up and you have to come back and make another appointment. We try and see them for their entire concern, or if there's any other health things that come up during that visit, the provider will address that. We have really high-functioning clinicians with a lot of experience in the young adult population. And the providers will personally contact the students if they have a concern within the next day, at the most usually, to follow up if they have symptoms. And then nurses return phone calls within 1 to 2 hours. Sometimes that might get delayed depending on if we have a lot of walk-in activity and a lot of illness going on. And then we have very reasonable charges. We try and keep our charges reasonable as possible for services. Accreditation, so we received our 3-year accreditation last summer. That's always a lot of work and can be a costly endeavor, so we were excited to get the 3-year, which is the highest you could get. And we had very positive feedback from our surveyors. They said we exceeded expectations, that we had a robust quality assurance program, and that they said that they would be happy to have their children receive care, and they told us that's the highest compliment they could give us. So we were very proud of our accreditation, our survey. We do a customer satisfaction survey every fall, and with those, so there's some of those results, and I won't go through everything. But we're proud of the fact that our satisfaction is high, and I think some of the important things there is the importance to the academic success and increasing their ability to talk about their healthcare needs, because that is part of our mission. And every fall when we do these customer satisfaction surveys, we take those results and we're trying to figure out a way to post them online too. But then we form task force and really try and get that feedback and put it into actionable items that we can use to improve. I won't read all of these, but we have some really positive feedback from the students, from our patients, which we appreciate. One was, I use the pharmacy once a month and have been to the clinic multiple times in my time here at NDSU and have never had a negative experience. The staff was always wonderful, and they worked to get me an appointment as quickly as I need one. Best experience in healthcare. When I first read that last one, I thought that student had been coming to our clinic for 20 years, and I was a little alarmed. But it actually says he's a 39-year-old student who has been using healthcare systems for 20 years, and talked about the fact that he thought ours was something that he thought was good. So that was good to see. Some future potential. So as enrollment grows, as all of us, our services need to grow. And currently, actually, we struggle with staffing. The more staff you have, the more appointments you can provide. So adding up potential MD or nurse practitioner with nurse services based on what the students are needing or saying that they want. Technology, that's a problem for us. We had a lot of computers crash today and had a lot of trouble getting them up because we're not replacing them as soon as we should. Improved access, really increasing that health and wellness promotion program, because prevention is the best thing we can possibly do. Maintaining facilities, which is an issue for all of us. That appointment availability. The dietitian is becoming an increasingly important thing. We all know nutrition is extremely important, and as we're identifying some needs with that, and then potentially case management. So how much student health service receives from student fees? We're currently at $529 per credit, and you can see that there. So we're about $1.6 billion. That's about 50% of our revenue, our current revenue. We don't have any other funding, or we don't have funding from activity fees. And then other, I think I'd already talked about that, so our other sales and service would be the other 50%. And this is just a comparison to some of our peers, and you'll see that we are at the very bottom of the range there. So the reason that we're asking for a fee increase is in FY16 we operated at a loss of a little over $30,000, and this year we're budgeted to operate at a loss of $217,000. So our carryover funds that we're using now would be depleted in a short duration. So our primary request is $1.20 per credit for a total of $77.88 per semester, or $155 a year. The secondary request is $1 per credit for a total of $75.48 per semester, or $150.96 per year. And then if we receive the $1.20 per credit, that moves us up just to the second lowest from the bottom. So we do try and run a very lean operation. Some of our current deficiencies, I think that overutilization, so as much as using per diem or non-benefited staff can be a good thing, you can have staff burnout. We increased our hours on Tuesdays to be open until 7 p.m. trying to meet student needs. Then you have people doing 12-hour shifts, which isn't always a positive thing. And then that inability to grow some of those essential and outreach programs. Increased enrollment, of course, is going to require more staffing and services, as we talked about. And the implementation of the electronic health record, we're really trying to change our staffing patterns and how we have our throughput with our patients, and that needs to be looked at. The pharmacy utilization is really increasing, and looking at the pharmacy. I talked about the delayed computer replacement. And then we're using a lot of equipment, furniture from surplus, so that ends up being an issue for our staff with ergonomics because we don't have very good furniture. External factors that require funding is our accreditation, that's state regulatory requirements. You have to meet those requirements whether you have funding or not, or you can't be open. So healthcare workers, that creates a little bit more competitive of an environment. Like med techs and some of nursing, as most of us know, there's a huge shortage in our community and probably throughout the nation. The Affordable Care Act, who knows what's going to happen with that. Looking at whether or not to bill third-party payers, that would be a cost to the clinic, but could be a potential revenue as well. I talked about immunizations, I think I've talked about all of that. So why is it essential to student health? I talked about that. It provides over 50% of our revenue, and like I'm being redundant. So why is it important is because we've always maintained that philosophy of really trying to keep our fees and our sales and service very competitive. So hopefully a student can come to the student health service and it's competitive or less expensive than it might be out in the community. The last time we had a fee was 2010, I mentioned that, so we really tried hard to sustain operations for 6 years, which then can end up causing a bit of a barrier with some of the other things that need to be, the improvements that need to be made. And then we had that increase of 54 cents last year. So right now our current performance increased by that last 54 cents really just helped us to sustain where we're at now. We haven't increased any sales or service or access. And student responses to the result is that we had 73% of our students say that it's important to their academic success, which is why we're here. And then we get positive feedback, as I've mentioned. Our contingency plan would be to utilize that carryover until it's depleted. Possible staff reductions, possible decrease in appointment availability, or a delay for sure, and decrease in programs and services. And what else? How we plan to improve. So I kind of had talked through that too, but really looking at all of those service needs and appointment availability. The health promotion is an important thing to have, I think, as far as prevention. And that is all. Questions? I went through that really fast. I should have said you could ask questions as you were going. Questions at all?
Does student health encompass like all the counseling services and all that as well, or is that totally separate?
Counseling is in the student wellness unit. There's the counseling center, career services, disability services, the wellness center, and then student health. But they're all funded separately.
Okay.
Counseling center is funded through appropriated fees.
Okay, thank you.
Anyone else? Quiet group today. Okay, well, thank you.